Hi everybody, Dr. Britt Talley Daniel MD, and I'm a neurologist and a headache doctor. Today I'm speaking on, is caffeine a drug? The definition of a drug is, quote, a medicine or other substance which has a physiologic effect when ingested or otherwise introduced into the body, end quote. Considering the symptoms of using caffeine, then it's very clearly a drug. It's a psychoactive drug which stimulates the sympathetic nervous system like adrenaline does. In the form of caffeine in coffee, it's the most commonly used drug in the world. So, is caffeine a drug? Caffeine is not only a drug, but an addictive drug, commonly producing symptoms in humans of a rapid heartbeat, increased ability to focus, increased physical activity and ability, and insomnia. Related questions. Well, who says that caffeine is an addictive drug? The DSM-5 says that. That's the current edition of the Diagnostic and Statistical Manual of Psychiatric Diagnosis, which includes in the list of addictive drugs caffeine in amounts as little as 120 milligrams a day. Can caffeine produce withdrawal symptoms? Criteria for caffeine withdrawal symptoms are prolonged daily use of caffeine followed by abrupt cessation or reduction of the total caffeine use. And then it's closely followed by headache or one or more of the following symptoms: fatigue or drowsiness, anxiety and or depression, nausea and or vomiting, and clinically significant distress or impairment in social, occupational, or other important areas of functioning. What is caffeine intoxication? The diagnostic criteria for caffeine intoxication are recent consumption of caffeine in excess of 250 milligrams a day and the development of 5 or more of the following signs during or shortly after caffeine use: restlessness, nervousness, excitement, insomnia, a flushed face, diuresis, gastrointestinal disturbance, muscle twitching, rambling flow of thought and speech, tachycardia or cardiac arrhythmias, periods of inexhaustibility or psychomotor agitation. Well, the approximate amounts of caffeine in various beverages. Now I have a web page at www.drmigraine.com. I have all this listed there, but for instance, a grande coffee 16-ounce Starbucks has 550 milligrams of caffeine, whereas just a regular non-gourmet coffee like Folgers, 8 ounces, has 135 milligrams. No-Dose or Vibrant has 200 milligrams of caffeine. The Monster Energy drink has, for 16 ounces, has 160 milligrams of caffeine. 2 etc. have 130 milligrams of caffeine. All the colas have some caffeine. Coca-Cola was the first, soft drink that had caffeine in it, and that's 12 ounces, has 35 milligrams, but Mountain Dew is the king of the hill there with 55 milligrams. They even got a thing called caffeinated water, and I couldn't find out how much caffeine was in that. Can you believe it? Caffeinated water. What are the pharmacological effects of caffeine? Pharmacologically, caffeine acts as a central nervous system stimulant. A point that's well made by the coffee ad on TV, which calls it the think drink. The duration of the effect of the drug is 6 to 8 hours, although some people have one drink in the morning, they can't sleep at night. Caffeine also acts as a constrictor of smooth muscles, which is found in arteries in the bladder and in the colon. And it's the arterial vasoconstriction action which helps with mild migraine. People use Excedrin, BC powders, and Bivactin, and that may lead to the rebound or medication-induced headache problem when withdrawals from taking caffeine. Coca-Cola has 35 milligrams of caffeine and was marketed in the United States after the Civil War over the counter as a treatment for migraine. The smooth muscle effect also acts as a mild stimulant on the bladder, promoting urination, and on the colon, a bowel movement. Can caffeine cause chronic migraine or medication-induced headache? Well, you betcha. The International Classification of Headache states that using caffeine 15 days a month can cause daily headaches in some patients, and that's called chronic migraine, or usually that's related to medication overuse headache. And the American Migraine Society has stated that caffeine is the #1 over-the-counter drug that causes medication overuse headache, which is found in about 3% of the world population, but in new patients in a headache clinic is usually 80–90% of new patients. What other medical problems can caffeine use aggravate? GERD, gastroesophageal reflux disorder, or so-called heartburn, generalized anxiety disorder, panic disorder, insomnia, epilepsy, death, rarely, and migraine medication overuse headache problems. I urge all caffeine-addicted patients, migraine patients, panic disorder patients, and patients with sleep disorders to taper off caffeine, which I said all through this talk is a drug. So please click on subscribe down there so we can follow each other. Check on YouTube for other podcasts I have on migraine as a subject. God bless all you persons who can't sleep taking caffeine, and I will see you on the next talk.